Everyone, welcome to my YouTube channel Anatomy with Rajahat. So today we'll be studying humerus, journal aspects of the humerus. This is your humerus. If you zoom in, so it is the longest bone of the upper limb. Proximally, it articulates with the glenoid cavity of the scapula at the glenohumeral joint. Okay, so this is your scapula and it is articulating with the glenoid cavity of the scapula, making your shoulder joint or glenohumeral joint. Distally, it articulates with the head of the radius and trochlear notch of the ulna at the elbow joint. So distally, as you can see, it is articulating with the head of the radius and trochlear notch of the ulna. The humerus can be divided into three parts, three main regions. One is the proximal extremity. This is your proximal extremity. Then there is your shaft. The shaft starts below the surgical neck. This is your shaft, and then this is your distal extremity. Now let's come towards each one by one. This is your proximal extremity and its main points. So if we study the proximal extremity and zoom in, so this is your proximal extremity. Now if you see, this is your head of the radius. Okay, this is your head of the radius. The head of the radius is smooth, round and smooth. It forms about 1/3 of a sphere. It is oriented medially, superiorly, and slightly posteriorly. So if you see, it is forms 1/3 of a sphere and it is oriented medially, superiorly, and slightly posteriorly. And then it articulates with the glenoid cavity of the scapula to form the glenohumeral joint in the shoulder joint complex. If opposite to the head of the humerus, if you see on the lateral side is the greater tubercle. So this is your greater tubercle. It is a large roughened elevation on the lateral proximal end of the humerus, lateral to the head. So it is lateral to the head. This is complete is your greater tubercle. Supraspinatus muscle, infraspinatus muscle, and teres minor muscles are inserted over here. Just medial to the greater tubercle is your lesser tubercle. So this hole is your lesser tubercle. Lesser tubercle is a small roughened elevation on the anterior proximal end of the humerus, just inferior to the head. So this is your head, and in just inferior to it is your lesser tubercle. Subscapularis muscle attaches over here. Okay, so if you see in this diagram that the supraspinatus, infraspinatus, and teres minor muscle are inserting onto the greater tubercle, while the subscapularis muscle is inserting onto the lesser tubercle. Now, what is anatomical neck? Anatomical neck. This is your anatomical neck. It is a small constricted area just below to the head of the humerus, slightly constricted region surrounding the articular surface of the head. The articular capsule of the glenohumeral joint attaches along the inferior edge of the anatomical neck. So your joint capsule just attaches just below to the anatomical neck. Fractures here are generally rare but may be more frequent in the elderly. Okay, so now let's study the surgical neck. What is the surgical neck? This is your surgical neck. Okay, this point is your surgical neck. This whole area is your surgical neck. A constricted area immediately inferior to the greater and lesser tubercle. So here is your greater tubercle, lesser tubercle, and just inferior to it is your surgical neck. This forms the interface between the proximal extremity and shaft of the humerus. So this is a borderline between the proximal and short shaft of the humerus. The surgical neck has important relations with the axillary nerve and anterior and posterior circumflex humeral art vessels. So fractures here are common, and a fracture here would cause injury to the axillary nerve and anterior and posterior circumflex humeral artery. If you see in this diagram, so if you can see, this is the region of the surgical neck, and as you can see this is your axillary nerve and posterior circumflex humeral arteries. So a fracture over here will damage this axillary nerve and posterior circumflex humeral artery. Now let's move on to the intertubercular or bicipital groove. This is your intertubercular. It is present between the two tubercles and uh, tubercles. It is present between the two tubercles, and what happens over here that the deep groove on the anterior surface of the humerus, that it is a deep groove that separates the greater and lesser tubercles, and it houses the tendon of the long head of the bicep brachii muscle. So it houses the tendon of the long head of the bicep, as you can see in this diagram that the long head of the bicep muscle passes through here, while this is the short head. Okay, so this is your intertubercular sulcus. Now let's move on towards the shaft or body. The most prominent feature on the shaft is your deltoid tuberosity. So this is your deltoid tuberosity. It is a roughened elevation, triangular elevation on the anterior lateral surface of the shaft of the. This is your anterior lateral surface, and it is a roughened elevation on the anterior lateral surface of the shaft of the humerus. This serves as an attachment site for the deltoid muscle. So your deltoid muscle, which is shown over here, attaches over here. What is radial groove? This is a shallow depression. If you move posteriorly to the deltoid tuberosity, so you would see there is a shallow depression over here, and this is your radial groove. So this is your posterior lateral surface, and you will see a shallow depression that spirals around the posterior and lateral aspects of the mid shaft of the humerus. It has important relations with the radial nerve and profunda brachii vessels. Okay, so this over here is your radial groove, and it has important relations with the radial nerve and profunda brachii vessel. Fractures of the mid-shaft humerus are common, especially inferior to the deltoid tuberosity, and may affect the radial groove and its content. So if you see in this diagram that the radial nerve and profunda brachii vessels artery are passing through this radial groove, and a fracture over here would damage these structures. Okay, so distal extremity. So there are two main structures in the shaft. One is your deltoid tuberosity and the other is your radial groove. So if we move towards the distal end, okay, so if we move towards the distal end, the first structure that comes over here is your lateral epicondyle. It is a small projection on the distal lateral side of the humerus proximal to the capitulum. So this is your capitulum, while this is your trochlea. Okay, so this lateral epicondyle, it is readily palpable. The common extensor tendon of the several superficial extensor muscle of the forearm are attached over here. They give the origin. Okay, so there is a clinical about here that if in tennis players or in violin players, there is inflammation of this tendon and then it causes tennis elbow. Okay, so this is your lateral epicondyle. Medial epicondyle, if you move towards the medial side, so this is your medial epicondyle, and a large knob-like projection on the distal medial side of the humerus proximal to the trochlea. So this is your capitulum and this is your trochlea. Okay. So this medial epicondyle is a large knob-like projection on the medial side of the humerus proximal to the trochlea. Okay. So this is the trochlea and it lies proximal to it. It is easily palpable and forms an important surface landmark in the arm. The ulnar nerve passes posterior to it in a shallow ulnar sulcus and is susceptible to injury over here by blunt trauma or bony fracture. So, if you see in this diagram that the ulnar nerve is passing posterior to the medial epicondyle. Now, what is capitulum? This is capitulum. It is a rounded half spherical. So, if we see that it is half spherical, okay, articular process at the distal lateral end of the humerus. It articulates with the head of the radius. So if you see that this capitulum is articulating with the head of the humerus, the shapes of these structures allow both flexion and extension and rotation. So the rotation, flexion and extension occurs over here, while the rotation occurs with the proximal radio-ulnar joint. Trochlea. This is your trochlea. Okay. So if you isolate this bone, this is your trochlea. And this trochlea is a pulley-shaped articular surface at the distal medial end of the humerus. The trochlea articulates with the trochlear notch of the ulna. So if you see, and and isolate this bone. So this is articulating with the trochlear notch of the ulna, trochlear notch of the humerus. Okay. The trochlea articulates with the trochlear notch of the ulna. The shapes of the articular trochlea and the trochlear notch, plus the presence of the humero-radial joint, limit the lateral movements of the ulna, resulting in essentially a hinge action in the humero-ulnar joint. So, here flexion, extension and rotation can occur, while over here this just flexion and extension occurs. Now, what is coronoid fossa? This is your coronoid fossa, a depression on the distal anterior end of the humerus immediately proximal to the trochlea. So, this is your trochlea and this is a small depression which is known as coronoid fossa, and this receives the coronoid process of the ulna when the elbow is fully flexed. So, if we see that this over here is your coronoid process. So, when the elbow is flexed, this structure goes inside this uh, coronoid fossa. What is radial fossa? Radial fossa is a shallow depression. Radial fossa is a shallow depression just proximal to the capitulum, and this receives the margin of the head of the radius when the elbow is fully flexed. So, when the elbow is fully flexed, so the margin of the head of the radius enters into this radial fossa. What is olecranon fossa? It is a depression on the distal posterior end of the radius, humerus. This is olecranon fossa on the posterior side, and this holds the apex of the olecranon process of the ulna when the elbow is extended. Okay, so when the elbow is extended, as you can see in this diagram, this is the olecranon of the radius, and when the elbow is fully extended, so it holds the apex of the olecranon process when the elbow is fully extended. So this was all about humerus. So if you did like my video, please do subscribe and like the channel. Thank you.